Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the continuous study. My dear friends, after the gap of few days, today we will again start with a very new topic, which is very important topic in pediatrics, that is leukemia. Leukemia in children is quite common. It's not a rare disease in children, especially the lymphoblastic leukemia. Acute lymphoblastic leukemia is quite common in children, and this is one of the differential diagnoses that we have to keep in our mind always when child has got recurrent fever and failure to thrive. Now anyway, so we shall see the details of leukemia in children in coming few classes. Let us discuss about the normal leukocyte function. Now as we know, the bone marrow house contains two types of the stem cells. That is, bone marrow is known to produce two types of series of cells. For that it has got stem cell for that. Now there are two important types of the stem cells which is present in the bone marrow for the production of the WBC. The stem cell which produce the lymphocyte, the stem cells which produce the lymphocytes, so that is called as lymphoid series cells, stem cell for the lymphoid series cells, and those produce the monocyte, neutrophils, eosinophils, basophils, etc. are called as myeloid series. So we have got two important types of stem cells present in the bone marrow which is responsible for production of a WBC. One is the lymphoid series, which is basically only producing the lymphocytes. Another one is the myeloid series, which is also producing another set of the WBC, or macrophages like monocyte, neutrophils, eosinophils, basophils. Therefore, the lymphoid cells and the myeloid cells, they produce when there is a call from the immune system after the antigenic response. So when they are produced, whenever there is a call from the immune system, when our body's immune system encounters an antigenic response, immediately there is a call from the immune system to the bone marrow to produce these cells. So immediately the lymphoid series and as well as the myeloid series will be activated and they produce more and more WBCs. Always lymphoid cells undergo the activation after antigen. That means whenever there is an antigen response, immediately when the body immune system faces or encounters the antigenic response from a bacteria or virus, etc., immediately the first one which will go into react is lymphoid series. Okay, so that lymphoid series is the first one which will react, and immediately the lymphoid series that produce the lymphocytes. So therefore, always in any type of infection or any type of antigenic response, the first produced cell is always lymphocytes. It is just like a local police. If there is any crime in the city, we know that always it is a local police which goes there and put a FIR and all those things, and then the senior officers will come, or they may call from other forces, etc. So similarly, the first response is always from the lymphocytes. Now this is a schematic representation. There is nothing special. Red bone marrow, which is present in the bone marrow, so that produces the lymphoid series and as well as myeloid series. From the lymphoid series, so we will have the lymphocytes, and the lymphocytes are released into the bloodstream, and they will be released as per the requirement. Whereas when we talk about the myeloid series basically produce the monocytes, eosinophils, basophils, and leukocytes. Now this is another important representation. From the bone marrow there is production of the lymphoid series and the myeloid series, and lymphoid series, they produce the proliferation will be there later, whereas in the myeloid series the reactive proliferation will be there. Reactive proliferation is there, and leukemoid proliferation and a leukocytic proliferation. These are the details we will see later. Now, action of the lymphocyte. Now, action of bone marrow house, leukocytosis and reactive proliferation. What this we shall see in detail. Now, there are actually two types of activities takes place in both lymphoid and as well as myeloid cells. Okay. So, what is one? The first one is reactive proliferation. Now, what do you mean by reactive proliferation? This occurs as a result of any infection, etc., by means of any antigens. That means whenever the antigens encounters the body immune system, the reactive proliferation will going to take place. And because of this reactive proliferation, this leads to increased number of leukocyte production, which is also called as leukocytosis. Okay. So now normal leukocytosis, it is 4 to 11,000 per microliter, and their proliferation always follows a pattern. To start with, they are precursors, then gradually they will going to develop. This is how the leukocytosis occur. So to begin with, there will be precursors. Then gradually they develop. Then they attain into a mature stage. And only the mature leukocytes are released into the blood when there is a need. See, all these precursor level development, then maturation, etc., these things will go to take place inside the bone marrow house. But when they are mature, these particular leukocytes are get released into the blood. Before that, they will not come to the blood. Okay, so when this occurs in lymphocytes, okay, so that is called as lymphocytosis. Same, leukocytosis, when it occurs in the lymphoid series of the cells, we know that it is called as lymphocytosis. If it is not occurring, we will give another name, that is called as lymphocytopenia. Penia means decreased production. Similarly, in the neutrophils, we shall have neutrocytosis, opposite of which is called as neutropenia, and likewise. So during this time, there is more production of mature WBC from the bone marrow house. So whenever there is a need, there is production of more and more mature WBC from the bone marrow house. Now this is how the leukocytic proliferation takes place. We have got the bone marrow stem cell, myeloid series and as well as lymphoid series. From the lymphoid series, we will have precursor lymphocytes. There will be precursor lymphocytes. Now these precursor lymphocytes, they undergo maturation. They forms the maturing lymphocytes. Then there will be a matured lymphocytes will be there, and these matured lymphocytes will be released into the blood. And in the blood, so they will reach as the vessel. In the vessel endothelium, now they are get attached or adhere to the endothelial layer of the vessel. So that means, in other words to say, they will be taking rest in the endothelium of the vessel. Whenever there is a need, immediately they will come into the action. Okay. Another type of leukocytic proliferation that is different, that is proliferation takes place in T cells, B cells and natural killer cells. That we will see in the next class. Okay. So this is the first one which is required for today. Sometimes the bone marrow house produces some extra WBCs into the blood. Okay, sometimes the bone marrow produces some extra WBC into the blood. For example, certain conditions. For example, there is any acute infection is taking place. Okay, if there is a stress phenomena, persistent stress is there. So naturally, this leads to more surge of WBC into the blood from the bone marrow. So now bone marrow. So whenever these triggering conditions are like acute conditions, acute bacterial infections, okay, or any other infections, or stress related condition, persistent stress is there. So these are some conditions where immune system is affected by one or the other way, and therefore it is a response, it's a stimulus, and as a response now bone marrow produces so many mature leukocytes into the blood. Even the WBC which is sticking to the arterial endothelium. Now what happens, I told, normally WBC which is matured, which is released into the blood, they come to the blood and they get stick into the endothelium of the vessel. Now sometimes even these endothelium which stick to the endothelium and taking rest, that also come into the circulation. So what happens is, hence the leukocyte level in the blood suddenly get increased. Patient is having some infection or patient is having some stress related condition. Okay, so because of which bone marrow is also producing more and more WBC and or leukocyte, and leukocytes which are adhered to the endothelial cells, they are also get released into the blood by leaving the endothelium. Now suddenly there is an increased amount of WBCs in the blood, up to 40,000 micro per liter of the blood, microliter of the blood. So usually 10,000 is normal, isn't it? Now 4 to 10,000. Now if it is increased up to 40,000 suddenly. Now in this case, blood picture shows acute rise in the WBC in the blood. Suddenly there is increased rise in the WBC in the blood. So if you go for a CBC, it shows that leukocyte is enormously increased, and this gives a suspicion of leukemia, because we know that leukemia there is increased number of leukocytes. But we should be very careful that leukocytes are immature leukocytes or blasts. Okay, that we'll discuss later. Okay, but here the mature leukocytes are get increased in the blood. It gives a similar picture of the leukemia. In the leukemia also there is rise in the leukocyte. Okay, whether it is matured, immature, blast cells, that will come to know later. But in the CBC, we will get increased leukocytes. Okay, so how to differentiate whether this is a leukemia or not a leukemia-like condition? How to differentiate? Cells are of normal type. That's what I'm stressing. In case of this particular condition, the cells are of a normal type, and they were all cytes, leukocytes, not leukoblast. Okay, leukocytes. And LAP, leukocyte alkaline phosphatase levels are normal. Leukocyte alkaline phosphatase level are normal. So these are the two important things which helps to differentiate that from leukemia-like condition. Now, interestingly, what is this condition is called as? When after the acute infection, stress or persistent stress, when suddenly the normal leukocyte count which increases in the blood, giving rise to suspicion of leukemia, this particular condition is called as Leukemoid reaction. This is called as Leukemoid reaction. Okay, so now what is the point? Point is we have to many times we have to differentiate between Leukemoid reaction and leukemia. So when there is rise in the WBC or leukocyte count in the blood, not always it is leukemia, because leukemia requires so many other associated symptoms also. Okay, but it is simply a Leukemoid reaction. So first differential diagnosis for leukemia is Leukemoid reaction. So from the blood, this is how the Leukemoid reaction takes place. Now we come to the next point. What is leukemia and what is lymphoma? Okay, in the leukemia, always the proliferation of these blast cells. What is blast cell? That we'll see later. Okay, proliferation of the blast cells that takes place inside the bone marrow, and there will be a very diffuse distribution is there, and these cells will never adhere, but they are immature blast cell. Okay, जो हम पहले बताते थे कि नॉर्मल मेच्योर ल्यूकोसाइट जो है वो ब्लड में आएगा, एंडोथेलियम को स्टिक होके अडर होके रहेगा, ठीक है, और जब जरूरत है तो वो रिलीज होगा. बट दिस टाइप ऑफ प्रोसेस विल नॉट टेक प्लेस विद द ल्यूकेमिक सेल्स. Leukemic cells are immature, therefore they are not able to stick to this endothelium. Okay, so they never adhere to the endothelium, but they are immature and they are blast cells. Naturally they are not at all leukocytes, they are blast cells. Okay, so they spread like the milk. जैसा milk spread होता है वैसे वो milk spread होता है, जब slides में आप देखेंगे. So this is about the leukemia. But what is lymphoma? Okay, we have got Hodgkin's lymphoma, non-Hodgkin's lymphoma, etc. What is lymphoma? Now few cells escape through the blood, some of the leukemic cells. Okay? So they escape through the blood and they reach the peripheral area, maybe in the thymus, spleen, liver, lymph glands, reticular endothelium system, etc. And they get stick there and collects into the cluster like a butter. Okay, and they start proliferation thereon. Now this is called as lymphoma. See, leukemia is just like milk, whereas lymphoma is just like a butter. Okay, basically talking cells are same. Leukemic cells and lymphoma cells one and same. One is the problem in the bone marrow itself. Okay, what is lymphoma? Lymphoma is nothing but one of the leukemic cell which is escaped from the bone marrow, coming into the blood. From there also it gets escaped and gets settled in some other peripheral portion of the body like thymus, spleen, liver, lymph glands, etc., and start proliferation there, becoming a malignant tumor there, just like a butter, get collected at one time, one area. So that is called as lymphoma. This is the basic difference between leukemia and lymphoma. In coming classes, we will go into the details of this. So this is again the schematic representation if you want. And what are all the types of proliferation of the leukemic cells, how the things will happen, and what is the pathology, and all these details will coming to we will discuss in the coming classes. So today is the basic class, introduction class. Thank you very much. Please keep watching my videos. Thank you very much.